Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Michael. How are you doing today?
I'm doing great, Dennis. How are you?
I'm doing awesome. Today, we met up at Soma, and we got to chatting for a while. You work at Cellox, so I thought it was a great opportunity to talk about hemostatic agents. But before we jump into that, would you mind just doing a quick introduction to yourself?
Sure. My name is Mike Weissman. Currently, I'm the clinical education manager at Cellox Medical, so we make a brand of Cellox Hemostatics. Prior to that, I was a Navy corpsman for about 25 years. I did 10 active and I did 15 in the reserves with, I was a SARC, Special Amphibious Reconnaissance Corpsman. So I have once I got off active duty, I became a firefighter in Vegas, and I did 27 years in a pretty busy system in Vegas, doing medicine and fire. So I got to do a little bit of both. And now I work for Cellox.
Hey, perfect. So you're the perfect guy to talk about just hemostatic agents in general. But I guess my first question is, way back in the day when I went through, I figured out if you just put enough pressure down on something, bleeding will stop. Gauze have been around for 12,000 freaking years, and it also can work. Why do I even need a hemostatic agent?
Hemostatic agents bring advantage, and that's really what they do. I mean, it doesn't replace training. It doesn't replace the fact that, I have to have something, you can't magically make bleeding stop. But if you have to pack a wound, tourniquets are obviously a pressure device, right? So tourniquets, encapsulate and compress the artery and the vein to a point where pressure can no longer flow out. But the reality of it is, it's a hydraulic problem. I mean, that's just really what it comes down to. Your body's clotting cascade is an amazing thing. It's an amazing process, 14-step process. It works instantaneously. The problem with that is it's not designed to work on major life-threatening bleeds. It works on, arterioles, small arteries. Potentially it'll stop it. But when you have that kind of pressure coming out from, let's say, a femoral artery, if you have a bifurcation of your femoral artery, both of them, you're looking at about 500 milliliters a minute coming out of that thumb-sized vein. That's a lot of pressure. And you can't just, sprinkle some magical dust on it to make that pressure go away. You really have to fight pressure with pressure. You have to put it against it. So let's say there is no hemostatic. Let's say it's just gauze or whatever you're putting in there. It's just time for your body's clotting cascade to sort of catch up and have the ability to form a clot. Otherwise, that stuff's just going to get blown off. As soon as it starts to attach itself to the vessel, to the vasculature, the platelets and things of that nature, and during the initial stages of the clotting, during the platelet plug formation, it's just going to blow off. Nothing's going to stay. So really, it's a pressure thing. I mean, it's a hydraulic problem that you have to fix. So you have to basically put equal pressure against it. Does that sound right to you? Does that make sense?
It absolutely does. I mean, so other than just the pressure, hemostatic agents, what does it provide?
So what a hemostatic agent, well, now granted, there's various hemostatic agents out there that work a little bit differently. So we can talk about, let's talk about bullets to start off with, let's say a kaolin-based hemostatic. A kaolin-based hemostatic basically works with your body's clotting cascade to accelerate that process. Now, it's still gauze, mind you, so it has a chemical on it that's kaolin. Kaolin is a mineral that comes from the earth, and it activates factor 12. So again, that's the first clotting factor that gets activated. So the clotting factors are numbered in where they were found, not necessarily where they're at in the cascade, but sort of where they were found. So kaolin activates factor 12, which theoretically accelerate the clotting process. But, the next question, why don't we just, shoot kaolin in there and spray it into the thing? Because you still, like we talked about, you have to have that gauze, that pressure in there to put something against the vessel to curtail the pressure coming the other way, so that kaolin has time to let its body do its actions and form that clot. Chitosan or cellulose dressings, those are polysaccharides. They work independently of your body's clotting cascade. And what the first thing they typically do is they're going to absorb fluid, and they're going to form a mucal plug at the point of entry, at the injury point. Sorry, and they form a viscous plug, right? So it's sort of, it becomes very thick and gooey, and the blood, again, it overrides the pressure coming from the artery. Not to mention, they're still attached to gauze as well. And again, there are various differences of the types of dressings as far as the polysaccharide dressings. They each work a little bit differently. Some of them have a little bit different properties, but those are how they sort of work that way. That's what. So the clotting, a hemostatic is going to basically accelerate the clotting cascade, and your body's going to form its clot faster, or it's going to work independently of that, and it's going to form a clot faster just because of like what we just talked about. It's going to absorb the fluid, and then also some of the Cellox brands and the Chital gauze and the ones that were polysaccharides are the ones they basically were also going to attract the red blood cells and some of the clotting factors to it, because the positive versus the negative of the blood versus the product you're putting in.
Okay. And does that mucal plug, does that make like a seal around the
well, with the gauze, it does. It's going to form a stronger clot. So basically, it's like, again, you take something viscous. Let's just use oil and water for the perfect example, right? And water's going to have a hard time. Oil's going to form that film over that water, and water's going to have a hard time sort of penetrating that. It's sort of the same thing. It's more viscous than the fluid. So it's going to be harder for that blood to permeate that plug, so to speak. But again, and then you also have the gauze aspects of it, right? So it's in addition to the gauze it's attached to. So you're still putting pressure there, and you're still holding that pressure up against it. So it has sort of a dual action piece. That's why you don't see very many hemostatics that are fluid or free flowing. We do make Cellox does make a granular hemostatic that does not have gauze attached to it, but you still have to back it up with a significant amount of pressure.
Yeah, I've seen lately there's like sprays. I think it's chitosan. It like comes out in like your mason, the guy's leg or whatever.
Yes.
And then you follow behind it with gauze, but essentially the same effect. Or the idea,
supposedly.
Anyway.
I mean, yes. I mean, I'm familiar with the product. I've not seen it being used. I've never used it myself. But yes, there's a few different products out there. There's one that's almost like in the consistency of hummus. It's a fluid. It's like almost toothpaste, like you're squeezing toothpaste into the wound cavity. That supposedly works. Again, I haven't seen it in person. I mean, I've seen it at the shows, just like you have. I've talked to the people, the guys who sell it. They say it works. Okay. I can't really say it does or it doesn't. I haven't seen any of the studies or anything on it, But
well, I mean, I
really
would imagine
back to the thing, but pressure is the key piece, right? You have to have pressure. I just, just based on my experience and everything else, you can't get good hemorrhage control without pressure, period. Be it pressure applied by a tourniquet or pressure by gauze, or pressure applied by a hemostatic that's gauze that has an additive to it, i.e. that gives you a little bit of advantage for that clot formation to be a little bit stronger and formed a little bit faster.
Does it have to really come in contact with the vessel? Like imagine you have some kind of injury, the wound itself is filling with blood. You can't just like shove it in there. You actually have to get it onto the defected vessel.
Yes. Yes, 100%. I mean, it's gonna, you could take, whatever product A, and you can put it into a container of blood, and it's going to, you're going to see clots formed, be it you'll see a mucal plug formed if it's one of the dressings I was talking about, or if it's combat gauze or kaolin based product, you're going to see that blood clot near it. But if it's not at the point of injury where that blood's leaving the vessel, then it's pointless. So you still have to understand, you have to have a strong understanding of your anatomy and physiology. You have to know where to put it. You have to know how to put it there. There's many different ways, of hacking wounds. And everyone's going to have their own specific, way that they feel they do it, be it make a power ball or not a power ball or whatnot. But the bottom line is you still have to get the gauze or whatever you're packing that wound at to the point of injury, to where that bleeding vessel is at. And that that's where the talent and skill come in.
Speaking of pressure, I want to say, I don't know if all do, but at least some of the ones that I've been using for years, you have to hold pressure for like 3 to 5 minutes, which when it's written on the package doesn't seem very long. When you're holding it on somebody, it seems like a really long freaking time. Like, why?
Again, each timeline, I guess, is proprietary to each product, depending on what you're using and how that product is designed to be used. A kaolin-based product, yes, typically the activation time is 3 to 6 minutes to get hemostasis for that product to work, right? And I think this obviously because it's working with the body's clotting cascade, it wants its body enough time to get enough clotting factors and stuff to the point of where that dressing can activate them so they can form a strong clot, because that's at the end of the day, that's what we're forming. We're forming a clot, be it a clot that's just blood itself. Let's say that's just the body, or we put gauze in there. Blood impregnates that gauze into that meshwork of that gauze and starts attaching there and forms a clot with that. Again, timeline dependent. It's there's no acceleration with that. And then you look at hemostatics. You look at accelerating that process, be it with your body's clotting cascade, that it just activates more of the clotting cascade factors in the body. Kaolin products do. Or if you're using one that acts independently of that mucal plug, that mucus, that thick mucus is going to slow down that bleeding, and then your body's still going to clot. The blood is still going to activate, and then it's going to sort of not accelerate, but it's going to help that. Trying to think of the best way to say it. The mucal plug will form, and then basically that viscous thing, the blood will not be able to penetrate it, which gives that clot time to form stronger, and it's going to stay where you put it. If that makes sense.
It does. So kaolin, the mineral stuff, that takes roughly 3 to 6 minutes, you mentioned. What about like chitosan? Should we be holding it the same period of time? So
so strictly chitosan-based dressings, because like Chito Sam and Chito Gauze, or Sam Chito, I'm sorry, that's the name of it. Those are they're chitosan, 100% chitosan dressings. Now, chitosan is not a mineral from the earth. Chitosan is the second most abundant polysaccharide in nature. It's in crustacean shells. It's in insect shells. They get it from fungus out of mushrooms. Mushrooms creates actually one of the brands out there gets their chitosan from mushrooms, from fungus. So basically, it's how that chitosan is used. So a strictly chitosan-based hemostatic, typically they are a 3-minute hold time. That's based on the manufacturer's recommendations. Now, Cellox is chitosan based. Cellox is not strictly chitosan. It's changed. We change it from a polysaccharide. We change it from a sugar. Polysaccharides are sugars. We change it to a salt. And Cellox Rapid, you're getting hemostasis in 60 seconds. So it matters. I mean, you look at 3 to 6 minutes versus 60 seconds. And again, understanding what you're carrying in your kit and the why you're carrying it in your kit, it matters.
Obviously, in trauma, we have the whole lethal diamond thing, and sometimes the body really doesn't want to make a clot when you really wish it would. So things like acidosis, hypothermia are some major players in that. Does that affect the hemostatic agent's ability to do its job outside of pressure?
Depending on which one you're using, again. So you look at there's multiple studies on trauma-induced coagulopathy. And if you Google like trauma-induced coagulopathy in military members, they say it's up to 40% of people are showing up to the medical treatment facilities with some type of coagulopathy going on. So if you're using a kaolin-based product, a kaolin-based product is designed to work with your body's clotting cascade. If your body's clotting cascade is not working as operationally is functioning the way it should, that product is not going to operate the way it should. I mean, that's 2 + 2. That's just the facts. That's science. Go on the internet and find that. Now, how degree of coagulopathy where that product's going to start diminishing its returns? There's no studies for that. It's hard to study our stuff as far as making that. But math is math. 2 + 2 is 4. And when you have a product that's designed to work with your body's clotting cascade, and your body's clotting cascade is not functional, be it like those things you said, hypothermia, the multitude of things. You bled out all your factors on the ground before the medic got there. I mean, there's an array of things that are going to create coagulopathy. That product is not going to be as effective as it should be, as if everything was 100%. Let's say everything being equal. Now you look at the chitosan-based products and the darn it, sort of had a mental block. But you look at chitosan-based, all the polysaccharide products, they work independently of that clotting cascade. So all that stuff does not matter. Coagulopathy does not matter. Being hypothermic does not matter. All those things that affect your clotting cascade, basically the products don't care, because that's not how they work. They work a completely different way. So again, depending on what you're doing and your thought process on how, where you plan on practicing medicine, it's important. You need to understand what's in your bag and how that product is going to work based on, the things we just discussed. Again, some of them, and really quick too, just so we're clear, a lot of people say, oh, you're using chitosan-based product, because most of them do come from shrimp, the carcasses, the shrimp crustaceans. And because, if you have a seafood reaction, you use that product on somebody, you're going to kill them. And there's nothing farther from the truth. So basically, chitosan's parent compound is chitin. So chitin is the actual product in the crustaceans and all the and exoskeletons of these different creatures. And what happens is when they take chitin and they process it into chitosan, that protein is removed that causes the seafood reaction in any of the chitosan-based hemostatics, not just Cellox, not chitosan. They all are processed the same. So there's nothing farther from the truth than that a chitosan-based hemostatic can potentially put somebody anaphylaxis shock because of that protein. So again, just knowing what you're using and why you're using it. And they have, like we talked about, they have different activation times. Again, most of them are 3 minutes. Cellox Rapid is a 60-second product because we are chitosan-based. We are not strictly chitosan. We do some other chemical modifications to the product, so it works a little faster.
Your entire company is kind of based around hemorrhage control. I'm sure you have some other stuff that's not, but at least what you're known for anyway.
Yeah, that's a big part of it.
You get a lot of practice when it comes to wound packing and hemorrhage control in those aspects. Do you have any tips and tricks that you've picked up along the way where people fall short?
I would say, just based on my experience, is the understanding your product and understanding how it's going to deploy is first and foremost. One, we've already talked about how your product works, right? But then how does it deploy, the second thing, and be very familiar with that. Does it have, tear spots on the packaging? Understand, when you pull it out, is it Z folded or is it rolled? Those are all critical pieces that you as a medic or any provider needs to understand. Because again, it's a game against the clock. Where the stopwatch started when that insult happened, and it stops when we stop the hemorrhage, period. And that's just it. So anything you can do to speed up that process of deploying my product, getting it out of the package, understanding what I'm going to do. Now listen, there's some people that do power balls, and they make a power ball and they push it to the point of injury. That's a preference thing. Right. And you're going to sit there as a medic. You're going to decide what you do with that. But the best thing that I could tell anybody who's practicing, medicine, pre-hospital medicine, and you think you're going to be dealing with traumatic injuries, penetrating trauma, people who are bleeding to death, is have a really strong understanding of anatomy and physiology, i.e. where the big vessels are, or where they're supposed to be, I should say. It's because, again, depending on what caused the injury, they're not going to look like a person. Their leg's not going to look like a leg. Their arm's not going to look like an arm. But you have to have a really strong understanding of the anatomy and the physiology of what you're dealing with. Because if you're looking at this mush that you thought was a leg and you see a bunch of blood spurting out sort of everywhere, you have to have a good understanding of where to start. And that was probably my best advice to people. Now, obviously, looking at, we haven't talked really about tourniquets, but tourniquets are obviously, if you could put a tourniquet on a limb, then put a tourniquet on the limb if it requires one, i.e. life-threatening hemorrhage. That's the easy button, right? Bleeding, yes or no? Bleeding, yes. Then the next question I ask myself is a tourniquet, yes or no? If I could put a tourniquet on it, I'm going to put a tourniquet on it because, again, that's pretty easy. The answer is no to that tourniquet. Well, then I have to pack. And then that's when things get a little tricky depending on where, right? You sit there and you look at if it's a true junctional wound, a true junctional injury, that's a problem, man. Those are problematic wounds, and you don't have a whole lot of time to sit there and read the roadmap. You need to know where to start pretty quickly. So I would say a strong understanding of your product and then a strong understanding of anatomy and physiology. The process of packing a wound, it's, because no two are alike. You just have to understand the basics of it. I need to get what we talked about earlier. I need to get this to the point of injury, to where the vessel is actually bleeding, not close, not, there's no awards for second, a second bad placement, I guess, That's to be on, you have to be on spot.
The bleeding is not always at the base of the wound, right?
True.
Sometimes it's coming out the side of the wall of the injury. Sometimes you're going to have to actually just pack against the side. So you just, visual inspection, find out where the actual bleeding is from, especially if you're talking like these big tissue defects like you get in the guys in Ukraine, probably today, from artillery or mortars, etc. You get some pretty large defects, and the temptation is just pack it as deep as you possibly can, and that'll fix it. That isn't always going to fix it.
Dennis, I know you've seen it 1,000 times based on where you work is, you're looking at some of these pocket wounds you create when people are doing LTT, right? And I try to set people up for success, almost show them the test before I give it to them, because if I don't, they're going to go to the deepest part of that wound, which is not 100% what you just said, is not where they're bleeding. And the only way you really know not to do that is have an understanding of the anatomy. And that's just the bottom line. You say, okay, wait a second. There shouldn't be a major vessel there bleeding out. It should be right here. And typically, probably 9.5 out of 10 times, if you go right there, you're going to be right.
Yeah. And it's like experience doing it for reals is costly and hard to come by.
Yes.
So just have, like you mentioned, just having real good understanding of anatomy. And we're not talking like, can you name this, 1 centimeter section where a junctional is, like the vessel runs roughly behind here. It's not next to the bone. It's actually, there's a muscle in between. So there's some standoff, basic knowledge.
100%. And know that there's a large vein next to it. And there's a nerve right next to that. I mean, they all sort of run in the same areas, and those are the pieces. And like what you just said, the collateral circulation, obviously, that's something that you potentially have to deal with. But if you got the major circulation down and you have, and you're in the spot and you're on that spot, then just by the sheer mechanics of you packing that wound bowl from apex to apex to the bone uphill is what I like to say it. And you make that nice pack job in there, and it's nice, compact, and tight. And when it's right. It's hard to talk about, but once you see it, okay, I did a good job, or the guy did a good job on this. You pretty much know. And the other thing that now we're talking about, to bring up another point too, is understand this too, is that these dressings are going to be saturated with blood. And I've seen it in my trainings and when I train people, especially some senior guys, that they feel that they have to have that pack job has to be white, like whatever the gauze looks like on the outside, like they stopped the bleeding so amazingly that it didn't even saturate that dressing through. And then if it does get saturated, they feel they didn't do a good job. So they pull it all out and they think they need to start again. Now, that's a gray area, right, of knowing truly when you have hemorrhage control and when you do not. And that is something, like you say, you get that through reps and experience. And if and that's, it's part of it. But if you have a horrific bleed, you have a femoral artery bleed, on anything, on a human, especially, or an animal, whatever you're dealing with, there's going to be a lot of blood, and you're going to be bloody, and your dressing is going to be bloody. But yeah, you have to have that knowledge base to understand, okay, I'm good with this, and I don't have, it's not going to become a wick where it's just going to start wicking that blood away. You have to understand, hey, this is doing its job, and it's not instantaneous. It takes time. Even, again, a minute seems like a long time. 3 minutes seems like a long time. 5 minutes seems like a long time when you're the one holding that pack job there before you start wrapping it. And it's just make sure it's doing its job. And there's a few different ways you can do that, but it's just it's important. It's an important piece.
Yeah, absolutely. Especially that wrap job, or even if you don't have a wrap job, you have somebody putting pressure. The guy's putting pressure in the wrong spot, or at the wrong angle of what you need it to be. Like, you're not doing anything. You're just wasting time.
100%.
Yeah.
100%.
What else so as far as just hemostatic agents, we kind of did the one over the world. Is there anything that you really want people to know about just hemostatic agents in general, or even specific?
I think, like we talked about a little bit earlier, I think as long as you have an understanding of how your products work, right, and know the differences and know the timelines that are associated with those different products, I think, because I see it a lot. I mean, I'm out there quite a bit, and there's people that truly, and I'm not throwing bricks at the TCCC committee. They're amazing. They have a lot of work to do, but unfortunately, they have so much work to do and so few guys there. Like, the civilian world, the military, it's pretty easy. Okay, these guys get it. But when we talk about civilian medicine, there's a lot of, especially when we talk about police officers, because there's a lot of people doing medicine out there that are not medics. Police officers are doing self-care, buddy care, just like we do in the military, and for these people to get an understanding of the products, like, hey man, this says this, and that's okay. This document, that's, be it dated or not, says that this is the primary thing designed for the military use. A lot of people go, well, that's the best, latest, and greatest thing in the world, and that's not necessarily the case. So do your research. Don't rely on any one piece of paper that's written out there. Understand why you're carrying it and what you're carrying and how that product works. And if all those capabilities line up to what you want it to do, then it's a win. But have that understanding, because I believe a lot of people do not have that understanding. And again, with technology advancements, listen, I'm just gonna be honest, the kaolin-based products that technology is almost 30 years old now. And there's not a lot of places that they can go with that. It's designed to activate factor 12. That's what it does. And if that's all you need and you want it, the other things we talked about, then cool, by all means use it. I used it for 25 years. I mean, that's what I used. But just like with all things with technology, there's advancements. You start looking at, Cellox is, I think we're in our 4th generation of technology advancements on our product, and I'm not sure where the other chitosan-based hemostatics line up with their advancements on their things, but we're pushing that ball forward, try to every year. We're trying to make it better every minute of every day. And I think we have, again, we're at 60 seconds. That's a pretty good time, but that's because we've trialed and errored multiple times to get that. But know what you're carrying and the why. And that's the piece. And that's just really where the rubber meets the road, and it's the same thing with all medicine. We sort of alluded to it earlier when we were talking a little bit, you guys know, you should know every medication in your bag. You should have a clear understanding of its actions and interactions and why you're using it. Well, it's no different when it's not just your medications, it's every piece of equipment in your bag. You need to have that same base knowledge of why. And if you can't answer that, well, then you better go find some answers. That's at least my opinion. So
yeah, absolutely. I think, you can spot there's, in my mind, there's a difference between just a medic and an actual professional. You can spot a professional really quickly by looking at their bag. If they have kit that's lined out very specifically, everything is in a specific spot, and it's lined up in a specific order. He could be just an anal retentive person, but the other 99% of them, they're actually professionals because they practiced and they set their kit up so that they can deploy it as rapidly as possible. And everything has its place and everything has a reason for it. And we set up our NARC boxes like that. We set up our airquake kits, hopefully like that. Hemorrhage control should really be absolutely no different.
Agreed. And I think a lot of the times, at least a lot of the assumptions is that hemorrhage control is a monkey skill. That, I don't need to practice this. I don't, it's easy, right? I practice it in the schoolhouse. I mean, depends on what schoolhouse you went to, be it 68 whiskey or a 18 Delta, right? Those are two distinct different pathways as far as medicine goes. But regardless, it's the same thing. They're at the same place at the same, maybe not at the same time, but they're at the same, when they go to work, they're at the same place, believe you me. And you sit there and like we talked about a little bit, is those reps, right? Getting that training. Like, how do we get these guys these reps? Because really you have to have unconscious competence when it comes to hemorrhage control in my beliefs. And what I mean by that is, it's second nature. It should be absolutely, man, I can do this blindfolded. Literally, if I could figure out where and feel the orifice and feel the blood pumping against my fingers, I can do this in my sleep 3 ways from Sunday. And the only way you get to that level is by practice, practice, practice. Now, there's 1,000 different ways you can practice these things. Again, I don't, just the leg with the little hole in it. Yeah, I mean, that's going to give you some understandings of things. But the how? Well, that's where, the senior guys, the senior line medics, the senior guys, they're the ones who should be coming up with these different scenarios and different ways to make sure that their guys have this understanding. And I don't think I think it's sort of put on the back burner because there's so many other things. In the civilian world, everyone's talking about blood programs, right? Blood programs are popping up all around the country, which is amazing. And I'm so happy that it's happening because it's going to save tens of thousands of lives, in my personal opinion. But what they're not talking about is they're not talking about their medics. How good is your medics at hemorrhage control? Now, you have the guys, I'm talking civilian medicine, you have the guys who are at these houses that see 3 or 4 gunshots a day. And they get tons and tons and tons of practice at penetrating trauma. Cool. Those guys might not need it. But now we're talking about the guys at the retirement station on the golf course. Those guys, I can do this. I know how to pack a wound. I know how to put a tourniquet on. I don't think you do, sir. I mean, that's just my opinions. And we have to get those people trained, and we have to get them trained up to a level, because you sit there, we can't put the cart in front of the horse. And that's the military as well, is we assume because we went to, SOC or 18 Delta schoolhouse, or we went to the PGA schoolhouse, or we went to the SEAL medic schoolhouse, and we had a lot of condensed trauma, i.e. packing a lot of wounds, for months, that's going to carry me through my career. And that's not the case at all. You look at, if you have those reps behind you, then that unconscious competence is just there. You look at a Delta Force or a Tier 1 operator, right? A guy who shoots guns, that guy's at the range every single day, shooting however many rounds he does again. So you can give that guy an M1 Grand and have him enter a building, and I bet you he's going to do pretty good with it. Now, you bring technology into that, you give him, his M4 and all his other whistles, and then, yeah, okay. It's the same thing with medicine. You get a guy who's unconsciously competent at packing wounds and putting tourniquets on. You can give him gauze and he's going to do a pretty good job. That advantage is not going to matter a whole lot to him, but it's still going to matter. It's still going to be a little bit better than he would without it. Now you take a guy who's not so much competent and you give him that advantage, then hopefully, you're going to see a decent outcome from it. And that's why we exist. We want to give people advantage, not just Cellox, but all the companies who do this stuff. We're here for a reason, and we believe in our mission. And we're just trying to move the ball forward a little bit at a time.
Awesome. So when it comes to different dressings and how they work, and say, I'm gonna deep dive on this and try to figure out which is the best options for me, right? Obviously, all the websites, they have their own research. How would I find out the information that maybe isn't a little biased?
Yeah, and I would look at, and the problem with studies in our world is really, really, I mean, you look at most of the evidence in the pre-hospital trauma world is level 3 at best, retrospective studies, which is a pretty high level, depends on how it's done. But that's what I would do. I would just, I would read the retrospective studies out there, and there's a bunch, I mean, again, and each company, you're right, is going to post the ones that benefit them the most. But do your own research, go to your whatever search engine you're going to use. And unfortunately, the problem with, especially like with medics trying to keep up with studies, it costs money, man. Those things are expensive. It's not like you can just go online and read everything. I will say that, you look at, Deployed Medicine has a really good site with the studies on there, and they're sort of unbiased, and they put, you give them the latest and greatest. And I think they do a good job of keeping up with what's relevant. But again, it's the same thing as the TCCC committee, man. Those JTS, those guys, man, they have so much work to do. It's like keeping that up on top of it is like an ancillary thing. But I would just say, just do your own research, man, and just try to find the studies that talk about it, because it's, I could talk about Cellox all day and tell you the advantages of my product, and I believe in all of our advantages. But you talk to a guy who works for Combat Gauze, he's gonna counter, and he's gonna say this, to his tit to my tat, But if you understand the mechanisms of how these devices work, right, the math does not change. If you look fundamentally on how, at the base level, on how these devices work, then you can get a really good, strong understanding of it. And then you can make your decision based on your clinical acumen on what you want to carry for your patients. Now, granted, here's the other piece. Sometimes, it's not like you can go out and buy your own stuff. It's issued to you, or there's, EMS, someone has to buy the equipment to hand it to you. So you have an opinion versus your medical director's opinion. Those are valid questions, right? And the reality of it is that he might not know, just because he has a doctor next to his name. I have conversations with physicians all the time that don't understand the differences between the products, and that's reality. That's okay. All you can do is educate, and then, the decision is where the decision is at, but, there's been a few decent peer-reviewed retrospective status analysis that have come out in the last 2 years, that talk about exactly what we're talking about today. And, just, read them. And, if you want, I'll send you one. and we didn't do it. So it's independent of us, but, it's good information. It's just good information to know. Awesome.
Well, I appreciate it, Michael. I really appreciate you coming on.
Well, again, I appreciate you having me. I just don't think it's talked about enough. I think it gets brushed under the table a lot. Guys going through refresher, okay, they're going to spend a week maybe in their thing. I'm not saying they're gaming your refresher or they're gaming anything else, but I think guys, once they leave their schoolhouses, they just, okay, I got this, and I'm going to move on to other more important, cooler things than that. And I just think you just have to keep practicing it. You just got to get those reps in somehow. And however you get them in, then get them in, but you have to get them in.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.